Okay, and we're going to hear more from Faiza in just a little bit. Right now, though, Toronto City staff have less than a month to provide proof of vaccination or face unpaid suspension. It's the latest push to increase vaccinations. Also, more clinics are opening this weekend ahead of the Thanksgiving holiday. Joining us live now for his weekly check-in, Mayor John Tory. Good morning to you, Mr. Tory.
Hi, Mel.
All right, so let's begin first with the latest when it comes to these vaccination clinics. Yet another tool in the toolbox when it comes to a vaccine strategy. What has uptake been looking like as of late? Obviously, these are a bit more targeted. Are people who are heading to these clinics, have they been just waiting, like, let's say, employees of the City of Toronto who feel like they need to get it, or are these people that just didn't have accessibility to it?
I think it's a bit of all of that. I talked to some of the people waiting yesterday when we were standing promoting one of the buses we have turned into a clinic, and it was in Thorncliffe Park. And I talked to a couple of people that were waiting. One was a young man that was there to get his second dose. He had brought his mother, who was there to get her first dose, and she had been just waiting, and she needed a bit of reassurance and a bit of comforting. And some of our neighborhood office people from Thorncliffe Park, wonderful partners we've had in all of this, had been talking to her and persuading her this was the right thing to do. Some are people, as you point out, who are responding to the vaccine proof requirements that are being imposed by lots of employers, including the city and the federal government. So I think it's a combination of people, and we just have to almost take it one at a time. It's different than the days when we had 25,000 people come to the Scotiabank Arena, or huge lineups at clinics that we had, mass clinics across the city. Now we're doing it kind of almost one at a time, but we're making progress. We're at 81% plus double vaccinated, 86% single vaccinated, and we've got to drive that double vaccinated number up to 90. And we're just going to take it one person at a time, one neighborhood at a time, one street at a time. And that's very much what I was talking about in the last day or two with respect to the clinics we'll operate over Thanksgiving.
Mayor Tory, how strong will the city be enforcing these deadlines given to workers to be double vaccinated, to show proof of vaccination? The deadlines here, if not showing proof by December 13th, potentially fired on these grounds. Will the city hold true to that specific deadline? Will there be any lenience at all?
Well, let's be clear. I mean, we don't want to fire or suspend anybody without pay. People do a good job for us. They need these jobs, obviously, for their families and so on. But we have a very, very important public health policy here that is meant to protect all of our workers and protect them from each other, as it were, and from the virus. We also have something that's in the interest of broader public health, because a lot of these employees have interaction with the public. And so, you have to have these policies taken seriously. And here's the good news, which is that, I think 89% of our employees have disclosed to us their vaccination status, and the vast majority of those have been double vaccinated. I think if you add up the ones that have been double vaccinated at about 89 and single vaccinated at 5, it means 94%. I think I'm right on those numbers, have been vaccinated in that manner, and that's all we're seeking to achieve. So I hope that by people seeing that there are consequences, which we always said there would be, and we always said that no options were taken off the table, that really what this will serve to do is to encourage the remaining people among our employees. And here we're talking about, for example, I think about 800 plus people who have said they don't intend to get vaccinated, or they're just not vaccinated, as opposed to those who haven't said. So that's a large number, but we'd like to work that number down, ideally to zero, in cooperation with and providing education and reassurance and whatnot to our employees, and having them understand why we're doing this, which is in the interests of public health and keeping governments, schools, stores, restaurants, concert venues, sports events open, and not having ever again, in the context of this pandemic, a lockdown.
Dr. Kieran Moore will be making his official recommendations later on today with regards to gathering numbers and protocol for Thanksgiving and for Halloween. What are you hoping to see? I think we know what we're going to hear when it comes to Halloween and gatherings. He sort of mentioned it in his previous news conference. But what about Halloween? What do you think is going to happen? What would you like to see?
Well, we've seen some of the guidance because they talk to us about these things, and Dr. Davila referred to it yesterday. And I think the watchword for both is, yes, go ahead and do it, but do it safely. So when it comes to Thanksgiving, limit the gatherings, check on the status of the vaccination of the people you're having, and that sort of thing. I mean, be outdoors whenever you can. On Halloween, it is largely an outdoor thing. And there again, I mean, be careful. Wear a mask if it seems like it's possible to do so. Keep your distance, stay outside. Be careful in terms of the distance you have with people who are not known to you when you're going to get candies with the kids. I think it's just common sense, really. But I think the bottom line in both occasions is that, very much unlike last year, we're going to be saying to people, governments are, provincial and local, yes, you can do this, but please do it safely. Please do it with an eye to the public health guidelines, so that you minimize any opportunity for the spread of this virus, which is still out there.
All right, Mayor Tory, as always, appreciate your time. Have yourself a lovely Thanksgiving. I won't get a chance
You
to
too.
talk to you until then.